3-year-old boy with drooping eyelid, excessive tearing, and crooked mouth while crying. Possible causes. Hi there. What is facial nerve palsy? The facial nerve 7 controls the muscles in your face, enabling us to perform actions like frowning, blinking, smiling, speaking, and eating. When the facial nerve is damaged, the facial muscles become weak or paralyzed, leading to symptoms such as: what is facial nerve palsy? Drooping eyelid ptosis. This occurs due to weakness or paralysis of the levator palpebrae superioris muscle, responsible for lifting the eyelid. What is facial nerve palsy? Excessive tearing. This can be caused by blockage of the tear duct or inefficient functioning of the eyelid muscles, leading to an inability to drain tears properly. What is facial nerve palsy? Crooked mouth while crying. Weakness or paralysis of the facial muscles involved in smiling and frowning causes the mouth to deviate to one side when crying. Difficulty chewing and swallowing. Weak or paralyzed jaw muscles can lead to problems chewing and swallowing. What is facial nerve palsy? Speech difficulty. Impaired facial muscles involved in speech articulation can cause speech to become unclear. Causes of facial nerve palsy. Causes of facial nerve palsy can include cold. This is the most common cause. Exposure to cold environments can damage the facial nerve. Inflammation. Middle ear infections, sinusitis, pharyngitis, meningitis, and other infections can affect the facial nerve. Causes of facial nerve palsy. Trauma. Head injuries, facial trauma, and other head and face injuries can damage the facial nerve. Other medical conditions. Respiratory illnesses, cardiovascular diseases, neurological disorders, and certain other medical conditions can also cause facial nerve palsy. Diagnosis and treatment. To accurately diagnose the cause of your son's facial nerve palsy, a visit to an ear, nose, and throat specialist is necessary. The doctor will perform a physical examination, review your son's medical history, and may order imaging tests like CT scans or MRIs to identify the underlying cause. Diagnosis and treatment. Treatment for facial nerve palsy depends on the cause. The doctor may prescribe antibiotics, anti-inflammatory medications, muscle relaxants, and other medications to aid in treatment. Additional considerations. Keep your son warm and avoid exposing him to cold environments. Follow the doctor's instructions for caring for your son. Engage in physical therapy exercises as directed by the doctor to help with recovery. We wish your son a speedy recovery.